Yeah, we'll wash the baby.
Rhianna Olds is 8.5 months into a high-risk pregnancy. She had been seeing a local specialist until her hospital stopped all labor and delivery services, citing staffing issues and what it called Idaho's, quote, legal and political climate.
Literally a month before we're supposed to have her, they're like, we're closing. And I'm like, so we kind of got set back in limbo, and we were just like, what do we do?
When the U.S. Supreme Court last year ended federal protections for abortion, Idaho enacted some of the nation's toughest restrictions, with doctors facing up to 5 years in prison for ending a pregnancy, except in cases of rape or incest or to save the mother's life. Dr. John Werdel is director of women's health at St. Luke's Boise Medical Center.
Nurses are nervous. Anesthesiologists are nervous. Pharmacists are nervous. Doctors wait. They contact the attorneys. We've probably all contacted attorneys more in the last, 8 months than we ever have in our careers.
No Idaho medical provider has been prosecuted under the new law, but Werdel says the perceived risk of that possibility is very real.
As soon as you insert fear into medical decision-making, that's where you get into trouble. And I think that's the bottom line, is you really want your physician to be focusing on you at a difficult time. You don't want them to think about the risk to themselves.
Idaho State Senator Ben Adams backed the abortion restrictions and is skeptical about their link to hospitals suspending labor and delivery services.
Sometimes people, see an issue that they don't like and they say, hey, we got to find a dog whistle and really push back on it. Hey, it is the way the world works.
Adams says lawmakers are balancing a healthy environment for medical professionals with not relinquishing what he says are the principles of the electorate.
Anytime there's a shift in the law, right, there are aftershocks that happen. That doesn't mean you go back and say, okay, then we're not going to change. We want to protect the life of the unborn in the state of Idaho.
For Rhianna Olds, her new birth plan includes driving more than 90 kilometers to the nearest hospital that can safely induce labor. She says she's worried for the women in her state.
Now I'm going to have 2 girls. So, do I stay in Idaho and raise them here, or do we up and move and somewhere else that is actually going to care about women and their rights? That's a scary thought.
Last year, there were 10 maternal fetal medicine specialists in Idaho trained to deal with high-risk pregnancies like hers. Werdel predicts that by year's end, there will be only 5 remaining. Deborah Bloom for VOA News, Sandpoint, Idaho.